And the series just features health equity champions like you and me who want to share their personal reflections on what is health equity and why it's important. So I invite you to reach out to us if you'd like to also be featured in our Just Health Voices video series. We'd love to hear from you about your perspective, your personal reflections on what it means to unlock opportunities for all in our county to achieve their best health. So you can contact us at healthequity@aacounty.org. Next slide, please. My name is Karina Limerick, and I am the program manager for the Health Equity and Racial Justice Office right here in Anne Arundel County Department of Health. We are delighted to host this forum on a monthly basis. And I just would like to thank our Anne Arundel County Department of Health leadership, which includes Dr. Tony Gedden, who is at the helm, and also Donna Perkins, who serves as the director of our Office of Assessment and Planning. The Office of Health Equity and Racial Justice is subsumed under her office, and we really do appreciate the leadership of both Dr. Gedden as well as Donna. Their presence today really demonstrates their commitment to health equity, and we appreciate their leadership. I also would like to thank the team that really supports just putting together these forums on a monthly basis. Without their contribution, our forums month to month would not be well implemented. So definitely want to appreciate and lift up the team. Today's conversation will illuminate ways in which Anne Arundel County communities marginalized by place and race are being served in our community through telehealth, through an annual health festival, as well as through emergency preparedness activities. So really delighted to welcome all of our speakers for today. And I want to turn your attention over to Dr. Gedden, who will introduce our first speaker.
Thank you all for coming, and those of you attending online. I'm always impressed that this meeting continues to have around 50 or so participants every time that we hold it. This is one of the only public forums that the health department has on a regular basis, and so really important that we continue to get information out and engage in this way. And so I thank Karina for all of her leadership and continuing to make these really useful meetings, because the fact that people keep coming means that they're getting something out of it. And that is difficult to do, to continue to keep people engaged. So thank you to everyone who continues to show up, and for the presenters who really do a fantastic job each month in making sure that it's a fruitful conversation. And so for today, we've got a few different folks, a real wide variety today, but we talked last month a lot about back to school and what that looked like. And Dr. Marcy White is the Chief Medical Officer at Total Healthcare. And so Dr. White is going to elaborate on the pilot program that we have going. And it's a partnership between Total Healthcare, our health department, and ACPS to really describe what this looks like, what we're doing with bringing telehealth into the schools. We're very excited to be working with them. And for those of you who are less familiar with what federally qualified health centers are, they provide services regardless of residents' ability to pay, which is why they are such fantastic partners and great pillars, but they do so much more and provide such great care throughout our county. And so I'll hand it over to Dr. White if she is with us.
I am here. Hello, everyone. How are you? I hope everyone can see and hopefully hear me. Can everyone see and hear me?
Yes, we can.
Okay, perfect. I can see, I can hear you now. Thank you so much. So thank you, Dr. Gedden, for that very warm introduction. And what I would like to just briefly speak with the team about is our telehealth school linked initiative that we will be partnering with 2 schools in Anne Arundel County. And thank you for Dr. Gedden for helping us to conceptualize this and to move this work forward on behalf of the students in the community. A Total Healthcare is a federally qualified health center, as Dr. Gannon mentioned. And as an FQHC, it is really our role to help to reduce health disparities. As you heard in the earlier video, those of you that joined early, really being able to provide care where people live, learn, work, pray, and play really helps to reduce some of those barriers that many communities experience, rural communities in addition to urban communities. And as was shared by County Executive Pittman, there's so much diversity in the counties that we need to make sure that we are providing services to all of the residents and making sure that no one is excluded, and making sure that individuals have equal and also equitable access to care. And that's really what federal qualified health centers do. And so we are here to partner within the county to provide those services. We can go to the next slide, hopefully. Yep, so school-linked healthcare is what I'm here to talk to you about. And as was mentioned, this is a partnership not only with Total Healthcare, but with also Anne Arundel County Schools and also the Department of Health as well. And so we want to provide high quality care to all of the residents, regardless of their ability to pay. And we also want to be partners in healthcare. We can go to the next slide. So we know as an FQHC, a federally qualified health center, it's a mouthful. We can't do it all. We certainly need partners, as you see on the opening slide, the health department, the schools, in order to be able to have those tentacles out in the community, provide great healthcare and great services. But we are fortunate at Total Healthcare, you can go to the next slide, to have 7 health centers located within the greater Baltimore area, where we serve nearly 30,000 patients annually. We provide a large variety of various services. You can see listed here, from adult primary care to pediatrics, to also wraparound services that we know are important to making patients whole and also making the community healthy. We do have some specialty services that we provide through Ryan White funding. We're able to provide HIV services, and also we have pharmacy in our 5 health centers, and certainly we also can provide prescription delivery to individuals as well as part of our pharmacy services. We provide podiatry services as well, and most importantly, being able to reach those that might have limitations in coming into the health center, and so being able to provide telehealth services. Next slide. So school-based health, what is that and how does it help to achieve health equity? And that's certainly being able to provide care where individuals are, where they spend a large majority of the time is in school. And we also know that education is a huge social determinant of health, and certainly having partners within the schools that can help us to address those other social determinants that we can identify in a healthcare setting. And so the school-based health centers help to bridge education and health, and to address not only just those immediate health needs on site, but also to address the other needs that students have in order to improve overall health and wellness. You also see here a list of services that school-based health centers are able to offer. And certainly some jurisdictions may limit what school-based health centers can offer, but they can offer a wide variety of services in the places where children and the community are. We can go to the next slide. So for the school-based healthcare partnership, primarily what we will need to obtain is consent, having the parent and guardian understand what services we're able to offer, and then consenting for those services. And as I mentioned, those services are provided in the context of what the local level, state law, and the jurisdictions and policies allow. They do not replace the services of the school nurse. School-based health centers traditionally provide services in partnership with the school nurse, and schools still need that school nurse capacity in addition to having school-based health centers. And they don't replace what's needed from the other supports. It's actually a complement to the other supports, whether those are social workers already in the schools or other support systems that the school is being able to provide. We can go to the next slide. So Anne Arundel County Public Schools and the Department of Health and Total Health Care are working on a school-linked healthcare partnership. So one thing that's different between school-based is that the health center is really co-located within the schools in the community. And we're hoping to have a flavor of that pretty soon. But what we're partnering now is to have a school-linked healthcare partnership where we're going to have 2 schools where we're providing telehealth services to consented families, and that will allow us to bridge the healthcare access needs and also the school needs as well. So we can go to the next slide. We're going to start out this partnership with 2 Title I schools in the county. That is Van Bachlen Elementary and then also Tyler Heights. We were fortunate to have the initial rollout and training of the partnership last week with the school nurse and also some of the leadership from the health department and also from the school system. Here in this picture, you'll actually see the gadget that will be used for the telehealth link services for the schools. Will be the apparatus that will be in the school nurse's office where the student and the nurse can be right there in front of the camera and also chat with us, and we can provide the telehealth services to the student and limit them having to leave school for conditions that, in partnership with the school nurse, we can treat and get the kid back into the classroom. So you'll see in the next slide our telehealth visit virtual care workflow that we have outlined. We will have as many students as possible consented for this prior to going live. The student visits the school nurse. The school nurse believes that the student will benefit from a virtual visit. Consent will be on file. We have the opportunity to invite the parent into the telehealth visit without the parent needing to come on site at the school, but certainly that's an option as well. But we also want to make sure that parents are engaged in this process virtually also. The school nurse will schedule an appointment via our portal with identified appointment times, which will then trigger on our end at Total Health Care that an appointment is being scheduled for our providers to then log on to the system and be able to meet the needs of the student and the nurse through a telehealth visit. We'll also be able to have the school nurse conduct point of care testing for certain flu and COVID and other disease processes, rapid strep, and also be able to order medications that the school nurse is able to give that the parent has consented to. As I mentioned earlier, we do have on-site pharmacy and also prescription delivery. And so as part of this, we can also electronically prescribe medication if we deem necessary as part of the visit for the student and have those medications delivered right to the student's home. We then have our staff that follows up with the parent and provide additional follow-up appointments. They can come to our Odenton location to be seen for any additional follow-up or set up any future telehealth appointments. So that's sort of a quick workflow. We really believe that this helps to address healthcare disparities because it allows us to be able to see students in their comfortable environment. Also, it allows parents to stay at work if they need to, and their kids are still being able to be seen by a healthcare provider, and also diminishes that need for transportation, which we know can be a huge barrier to accessing care for many of our families, and then still gives a way for the parent or guardian to be involved in the appointment. So we really believe that this is going to help to care for many of the students. We are piloting out in these 2 schools so we can really iron out the kinks. And then the goal and hope is that we can expand this to other schools as we really demonstrate the need for this service in the other schools. So that's quickly in a nutshell our presentation. I'm happy to entertain any questions.
Thank you so much, Dr. White, for that overview. I would like to, yeah, perfect.
Hi,
Wonderful.
Dr. White. Thank you for this pilot. I'm curious if there's communication back to the child's PCP.
So we will be able to provide a health summary back to the parent.
Dr. White, if you can just repeat your response, the reception is a bit poor.
Okay, let me see if I turn off the video. That might help. Okay, is that a little bit better?
Yes, we can hear you now.
Okay.
Thank you.
Excellent. I was mentioning that we're going to be sending a health summary to the parent after the visit, and the parent can share that with the PCP or whomever they would like to share the information to with.
I have a question. Thank you
Yes.
very much. Wonderful presentation. This is definitely being very helpful for the parents and the kids. I wanted to know if there's any restrictions or limited in mileage, so the distance that the medications are going to be delivered to.
I have my chief pharmacy officer, Dr. Oriafo, on the phone. I don't believe so. Dr. Oriafo, are you able to come off mute and share about our pharmacy prescription delivery?
Sure. So right now we offer free delivery within 20 miles of any of our pharmacies. So I can imagine that should cover the majority of the students. And, depending again, if we have to, right now, as Dr. White said, our goal is to make sure that we don't deny patient access to healthcare or to medication. So again, in our experience, majority of our patients live within, within that 20 miles. It's more than, enough mileage, but if we need to send something out, to a student, then we'll do what we need to do.
Thank you.
If you're joining us virtually, feel free to submit any questions on this telehealth presentation via the chat. Or if you'd like to share your question verbally, we can certainly have you do so at this time. Any other questions?
I should have.
Aisha?
Hi, I just wanted to add to Dr. White's presentation. Thank you so much, Dr. White. She didn't mention that they will have. She didn't
Aisha, if you can just pause one moment, we'll see if we can mute that line. For those who are not speaking at this time, we encourage you to mute your lines to minimize background noise. Okay, Aisha?
Sure. So I was going to say, Dr. White, please mention that they will have interpreter services. So if needed, based on the consent forms, the child's or the family's preferred language, they also can add an interpreter to the call, not a language link, but a live interpreter.
Karen Siska-Carrillo, the Director of School Health. The wonderful thing about this program, in addition to all the things already mentioned, is there is after school hours, weekend and night availability as well. So it won't be from our health room, but they most certainly, the client, the patient, and their family can access it. They'll have a link that they can do it through their cell phone, just like a lot of us did during COVID, where we had virtual doctor's appointments. They can do the same thing through telehealth. So it's a wonderful, wonderful program that's here. And the delivery of medications is awesome. It is wonderful. That is a huge, huge barrier, remove to barriers that have been there. Access and then the access to meds. So we're thrilled.
Thank you so much. We received another question. They said that this model sounds wonderful. Is this in place elsewhere?
So I'll take a stab at that. So when we first started discussing this, we did look around to see what other jurisdictions are doing, and some of them do have hybrid models. In Anne Arundel County, we do not have school-based health centers, so there aren't providers stationed in the schools, so nurse practitioners or physicians in the schools. We have a nurse and health assistant model. So there are some jurisdictions that have school-based health centers where you can already go and see a provider in their location. And then some of them have implemented some hybrid versions of that. I don't know that they have exactly what we're doing, but there are different variations around the state. versions of this. And so we're looking forward, and we've worked with those other jurisdictions to learn what we could, looked at their policies and procedures, things like consents, to try to learn from them as to what worked there to really make families as comfortable as possible, and what was possible on our end. And I'd really just like to thank Dr. White and our school health leadership. This has been a lot of work. It's been well over a year that we've been working to pull this together and to make this happen. And I don't know if, for those of you who work in contracts, to get these three entities to sign an agreement together is not a small feat. So I really just want to thank them for continuing to move forward with this and to really try to bring these services into the schools. I think it's going to be wonderful. We'll work through the kinks. I'm sure we'll hear plenty of feedback initially. But I do want to thank them for all of their tireless leadership in making this happen, moving it forward.
Thank you, Dr. Gideon, for your leadership in pulling this forward. It really shows the value of partnerships.
Absolutely. Thank you so much for your overview, Dr. Wright. So at this time, we're going to transition to our next presentation, and we're going to pivot a bit and focus on emergency preparedness. If you don't mind. So I'd like to introduce our next speakers. If you can advance the slides, emergency preparedness. So this month is National Preparedness Month, and we are pleased to have two of our subject matter experts in this topic area with us today. Preeti Emmerich is the Director of Emergency Management for Anne Arundel County and has over 15 years of experience in emergency management and public health preparedness. She's worked for local and state emergency management agencies and health departments, as well as in the private hospital sector. Debbie Saylor has spent over 20 years in the field of public health emergency preparedness and currently serves as a program manager for the Office of Emergency Preparedness and Response with the Anne Arundel County Department of Health. Ms. Saylor is a registered nurse and obtained her Bachelor of Science in Nursing from York College of Pennsylvania and her Master of Science from the University of Maryland. I encourage you to scan the QR code if you'd like to see the unabridged version of our speaker biographies. And at this time, I'd like to turn your attention over to our next speakers.
Well, good afternoon, everybody, and thank you for having us here. We can go to the next slide. So we're going to be talking about emergency preparedness through the health equity lens. What's been emphasized here is partnership, right? So Deb Saylor and I have worked many years together in a partnership in order to provide not only the county, but our partners with the best emergency preparedness for the community and for the many different types of companies.
Right, you can go to the next slide. So what is public health emergency preparedness? It is the capability of public health and healthcare systems, so our hospitals, our long-term care facilities, other providers, communities and individuals to prevent, protect against, respond to, and recover from health emergencies, particularly those whose scale, timing, or unpredictability threatens to overwhelm routine capabilities. So I think if I ask you all for an example, everyone will probably say COVID. We also, there have been several others in recent history of the 2018 Capitol Gazette shooting. We provided mental health and health services support to the witnesses and survivors. And also, I think it was 2016, the Zika outbreak. We, I'll get more into that in a little bit, but isolated the cases in a neighborhood and then did community outreach and inspections of the outdoor areas surrounding those cases. So how do we do all this? We coordinate our activities with our County Office of Emergency Management, who is the kind of coordinating hub for emergencies. and as well, and the city of Annapolis, Office of Emergency Management. But our other partners are, the mental health agency, the fire departments, the police departments, the school system, our, local community college, the American Red Cross, Department of Social Services, and on and on. The Office of Emergency Preparedness and Response within the Health Department is responsible for developing, testing, and maintaining our emergency plans. And that includes our emergency operations plan, which kind of lays the foundation for our concept of operations and authority for any type of public health emergency. We also train and exercise those plans. We maintain a cache of supplies and equipment that are, can be rapidly deployed to support the response, such as the mass clinics for testing and vaccinations that we established in response to COVID. And we also do a great deal of public outreach. We attend different fairs and events throughout the county and provide public health emergency preparedness information and resources at those events.
Next slide, please. So what does Anne Arundel County Office of Emergency Management do? I get this question a lot, like, what is emergency management? Again, that coordination piece is important to help the community prepare, respond, and recover from disasters. And there's different ways we do that, and I think Deb went over that a little bit, operations planning. Again, making sure we have the plans, making sure our county entities are trained and exercised in it, but also making sure that the community has knowledge of our plans and understands how they themselves play a part in what we can do as a county, right? It's the whole community concept. We really preach in emergency management. The county has responsibilities, but communities can do so much in preparing their families, their neighbors, and what to do in a situation. A lot of that comes through in our communications and outreach and how we do the outreach centers on what kind of community we're doing outreach to. Not everybody's the same, and that's good. And we want to make sure we have the different approaches to make sure everybody's prepared. And then our special projects, a lot of what we do, especially in environmental resiliency, as you see from the storm just this weekend, right? That causes a lot of environmental damage, which also plays a role, and especially in how communities thrive. Next slide, please. So the emergency management cycle. I touched upon the preparedness, the response, and the recovery. It's a little bit more than that. When we talk about prevention, we do our part to try to prevent as best as we can, but we know sometimes that doesn't happen, right? So then how do we mitigate it? We know it's going to happen, but how do we lessen the effects of it? And then preparing, making sure that people understand the steps beforehand and being prepared that if something does happen, how they can respond, which is the next step, because things will happen, right? And how we prepare really impacts how the community will respond. And then that leads to the recovery. And all this plays a role not only in natural disasters, but in many different kinds of situations. We talk about when the Afghan refugees came, I think it was a year ago, right? How that whole community preparedness, we had so much help from many different partners. That again, these steps plays a role in how we can help each other. Next slide.
So the unique needs of vulnerable populations within the community are incorporated into our plan. So this is kind of why we're here today, to talk about what we're doing now and solicit, you know, any suggestions or comments that you may have. This is some information from the National Academies of Sciences, and while this isn't an exhaustive list, it shows some of the vulnerable populations that we have considered and have planned for. With age, children and the elderly are more vulnerable than most. Race and ethnicity. We'll go into a couple examples of this in the upcoming slides, but non-white recent immigrants. Preeti just mentioned the Afghan refugees, with the migrants entering the country at the southern border. That's something we're preparing for locally as well, to be able to meet the mass care needs of those folks. Also non-native English speakers, and then income. And this one is huge, you know, the poverty level, people who have jobs that lack paid leave. So if there's an emergency, and they're unable to get to work because of flooding or for whatever reason, they're not gonna get paid. And that can lead to, you know, cascading effects and, you know, maybe lack of money for health insurance, or the level of health insurance, funds available to recover from an incident. Another example, groups with functional needs, such as the disabled, those that are unhoused or living outside, a lack of transportation, to evacuate an area or to get the resources you need to be able to support yourself and your family during an emergency. Health, of course, is a big one for us, those that are chronically ill or again, uninsured or underinsured. An interesting one is gender. Our plans do incorporate the needs of the LGBTQI plus community. Also, women more so than men could potentially have more significant impacts following or during and following an emergency. Housing tenure, those that rent, what happens if their rental property that they live in is damaged or destroyed, or a lack of long-term housing. They have less access to post-disaster housing programs that are designed for people who are homeowners. And then a lower post-event return rate, you know, they may not have a place to go back to and no ability for them to make decisions regarding the property that they were living in. In education, again, you know, those with low educational attainment may have a lower awareness and understanding of mitigation that Preeti just talked about. So we have a couple examples that kind of highlight our work in this area or why this is an issue first. Next slide.
So obviously with Hurricane Katrina, one of the biggest disasters in this nation, it really highlights the experiences of the racial inequity, but also the social economic. And a lot of this, I mean, you could read the data, the slides of how, you know, different communities were impacted. And this highlights a couple of things, right? If you talk about distrust of government, this did not lend the trust in government by communities that still lingers on today, right? In terms of our outreach. If you talk about a local example, the tornadoes that went through the city of Annapolis impacted a low economic neighborhood, the neighborhood of Pearl, that where it was generational housing that didn't have documentation, the education level was a little bit lower. So if you think about some of the state recovery programs that were available, it was difficult for the community, number one, to obtain that documentation. The application process was long, multiple pages long, asking for multiple documentations. It was hard to understand. And so that really highlighted how can we make our preparedness efforts, our recovery efforts accessible to everybody. Because what Deb talked about previously exists every single day, right? But when a disaster happens, when something takes away those programs that are there, it just highlights even more what we need to do. And it's that much harder for communities such as this to recover and to access those programs again. When a disaster happens, it is hard on everybody. But when you don't have the resources in day-to-day living, it is that much harder.
And one thing that we've done to mitigation that we've done to kind of address this is establish, what do they call the post disaster recovery center?
Yeah, so are you talking about the State Disaster Recovery Fund?
No,
The Family Information Center?
no. Preeti's office goes out into the community and works directly with the folks that were impacted. So making sure there's eyes on and hands on to let those people know about the resources that are available.
Our damage assessment process, where we do go out to. I'll give a name to it, but instead of communities just reporting to us, we would like to go there and meet with the neighbors and have them tell us face to face, this is what I need. Because it's sometimes not even just rebuilding a house, it's mental trauma. I'm too afraid to go out to get food. I'm too afraid to send my kids to school. I can't see my doctor, I can't get transportation. And those are the things that I think in traditional emergency management in years before was a little bit lost. And this is how we're expanding. Next slide.
So another example, and the health department really did a lot of work in this area during COVID. There, you can see here that the case rates by race and ethnicity certainly were higher among populations that were non-white, including Hispanic and Black individuals. And we did use this data to drive our response, and we'll get into that coming up. So more to come on that. Next slide. So where do we get the data? I should let Donna do this. She's our director of the office. The Office of Emergency Preparedness and Response, the office that I manage, sits under or within the Office of Assessment and Planning, and they are able to pull and read and present data in some pretty incredible ways that drives almost all of the work that we do at the health department. And they complete is an annual community health needs assessment, which is that annual.
There's an annual, I'm gonna talk about this. I can, everybody, so there's an annual report card that's produced that just keeps a pulse on some of those, just kind of immediate important indicators. There's also a community health needs assessment process that happens every few years. So that's a deeper dive into the data. Many of the challenges that are identified there, they don't change, so much from year to year where we would necessarily have to do that every year, but it looks at everything from your social determinants of health. So housing costs and who's renting and health insurance and, all the pieces that feed into those inequities that they were describing earlier.
And the epidemiology team also creates dashboards and shares them that show snapshots of specific public health threats and incidents. Also, we get data from the Maryland Department of Health, the Centers for Disease Control and Prevention, the CDC, and the Agency for Toxic Substances and Disease Registry created a social vulnerability index. And if you send out notes, Karina, I can send you a link to that because it's some good data. And then the U.S. Census Bureau. Next one.
So when we get this data, Deb talked about more probably the analytical of the data. But we meet continuously with our community partners. We have coalition meetings with the city of Annapolis and Anne Arundel County partners to just, be touch base on what's going on and the emergency preparedness programs, the plans, the training and exercises, and what's happening. And again, we meet fairly regularly with our partners, and that could be nonprofit organizations, volunteer, houses of worship, anybody who wants to help and has a pathway to a community. We are more than happy to give materials, to give presentations, to learn more about the communities, because that helps us better serve the residents of Ann Arbor. So that public outreach is very important. And after each incident, we do an after action report because things don't go perfect, right? And so we want to make sure we learn from our lessons and improve upon them. And you want to talk about the community surveys?
Pre-COVID, seems like a million gajillion years ago, we conducted a community assessment for public health emergency preparedness survey, where we went door to door in targeted areas throughout the county to get information on household knowledge of emergencies and what the biggest threats are in the area where they live and what they've done to prepare. And we use that information to inform our planning. Hopefully we'll get back to that at some point, but another very valuable tool.
Excellent.
So what do we do with all this data? All the, like I said, we use it to to inform our planning and plan revision process. You know, as we learn more, as we have access to other vulnerable groups, we incorporate that information into our plans. We use it to identify and mitigate barriers to resources. We use it to target our outreach efforts, not just within the Office of Emergency Preparedness and Response, but throughout the health department. We all provide public information in multiple languages and formats. As Pri talked about a little bit, we seek out partnerships. When a gap is identified through following an incident or following an emergency exercise, when a gap is identified, then we'll seek out individuals that or groups or agencies that can help us address that gap. We use it to find appropriate facilities for mass care operations, including our Family Information Center, which is our reunification center plan, our mass care shelter plans. Next slide. So examples, I mentioned COVID earlier. So the establishment, we use the data, the case rate data and other information to establish, to kind of pick out where we were gonna establish our pop-up COVID testing and vaccination sites. We did that in areas with higher than average case rates. Also, the development and dissemination of informational materials in multiple languages in response to the Zika outbreak. And as I mentioned earlier, going to the different communities and knocking on every door within, I think, 150-yard radius of a positive case, and ensuring we had the materials to be able to effectively communicate with each household. But that's one of the things we use the data for.
And just from the Office of Emergency Management side, understanding that we really had to delve more into communities and some of their unique needs. When we talk about mass care planning, the appropriate gender considerations to make sure everybody feels welcome, right? To make sure if you're transgender, you have the medications you need, that if you lose your residence, that you feel welcome in the shelter, but that you have your supply of medications as well. Something that wasn't considered before, but now in our plan. And of course, a coordinated, targeted public outreach. Next slide. There's a few pictures of how we've expanded our outreach, especially geared towards children. There's Pepper the preparedness pup, making sure she takes a rubber ducky with her because she feels safe with it, right? So even at a young age, we can teach people about preparedness and how to be ready. And next slide. And thank you. If you have any questions, more than happy to answer them, or if you want to email, please let us know.
Thank you so much for your presentation. We encourage you to do both. You can reach out to us at healthequity@aacounty.org with your questions. You can certainly input them in the chat. We do have time for just one question. If anyone present with us in person or virtually would like to ask a question.
I would like to, if I may, just say thank you. Thank you for everything that you do. You're looking at a person that was saved many times. I lived next to a river all my youth years. And here comes the government to get us out of the house. My mother lived to be 60 because of that. So thank you for all your information and how we were reminded a few days ago that the tropics are not the only one getting hammered by hurricanes like we did. I'm from Puerto Rico. So we get that every single year. 1, 2, 3, 4 times a year at a time. So it's a challenge for us. But I've been out of the island for 42 years and now I'm immune somewhat to all that. But I still have 10 brothers and sisters back home that I'm reminded every time a hurricane comes through. Let me call to see how they're doing. So thank you for your inclusivity of everybody. I love that. And keep it safe.
Thank you.
Thank you so much. So I'd like to introduce our next presentation. We are going to celebrate Hispanic Heritage Month. And with us, joining us today, 3 of the festival steering committee members. I just would like to share their names. So Bishop Torres, who you just heard from, he's the vice president of the festival steering committee. We also have Carlos Camino. He is the founder of the Hispanic Health Festival, and Elizabeth Bray. She's the health services coordinator for the festival steering committee. She will be presenting today, talking about our Hispanic Health Festival. And I do want to acknowledge the president, Maria Casasco, who is not able to join us today, but certainly she's sending her best to the rest of the community members.
I have to speak on behalf of Maria. What a wonderful woman she is. She's very sick. She came back from California and lost her voice. She is at the moment at her doctor's office. So, but Elizabeth is here on behalf of our entire committee. So Elizabeth.
Thank you very much. Thank you for having us and always embracing the Hispanic community. So what I'm going to be showing you is a little bit of the history of the Hispanic Health Festival. This year we are programming to do Saturday, this coming Saturday, September 30th. We try to do always in between September and October, of course, and we try to do it in September because weather reasons also. Sometimes in past years we have to, oh my God, last minute things. Every year is an adventure, but we love that adventure. And so next slide, please. So we have a vision and mission, and our vision is to impact the Hispanic Latino community in Anne Arundel County. And we have the big gift from the health and the knowledge to access community resources. So what we try is to promote the strong health awareness and encourage the Hispanic Latino community to assume responsibility. You were talking about education, and that's the basics for everybody. And our festival is, our main effort is that people come to the festival, learn about how to take care of themselves, but also educate them in how you can do it. And I have seen other partnerships like Rural Healthcare or other federal qualified health centers that are doing a great job. So next one, please. We are just 4 people in our committee. Maria Casasco, who is the president, Bishop Jose Torres is the vice president, and the health service coordinator, and Carlos Camino, as you mentioned, is the festival founder. That's our phone number and our email address. If somebody wants to email us and do questions, you're welcome. Next one, please. The Heritage Month is celebrated between September 15 and October 15, and we try to talk to everybody, and everybody's welcome from any country. We are trying to do different activities for every single ethnicity that comes over there. Next one, please. The host venue is the Heritage Community Church. The coordination by community and government agencies like Anne Arundel County government, local medical partners, local Hispanic Latino groups, Mexican consulate, and other Latin American consulate. Since the pandemic, we are trying to bring along as many consulates as we can, because many people have lost papers. Many of them are behind the updating their paperwork, so the consulates are trying to do their best efforts and reaching out as many as they can, which helps to any of the emergency situations that we may have, you know, and I think. Next one, please. Since 2010, the Heritage Community Church that's located in Severn is the host venue. In the past, members of the Hispanic Latino community asked to have the festival moved from a local school to a church. They are open and willing to share their private information with agencies they feel safer in that type of environment and trust the clergy leaders. So we did in the past, like 10 years, 12 years ago, we have asked the different churches where they would like to be. So they asked the people that attend those churches, and most of them expressed that they would like to be moving the festival into a church, and that's why we were looking at some church that would like, and Pastor Torres was kind enough to offer, because we don't have we didn't find anybody on the north side, so that's why we moved to the Heritage Church. Next one, please. Our goal is to provide health, vision, dental care services, information, and community resources to at least 1,000 to 1,500 people attending the festival. The first years, we had like 350 the first festival, because I began in year one also, so I'm 21 years already with this. This is our 21st anniversary. And one thing that was amazing is that how we were able to partnership, and until today, I try to bring as many resources as we can, and I can't complain about that. I always have somebody that's calling and saying I'm helping, and that's one of the marvelous things with this festival. Next one, please. Our objectives is empower the Hispanic Latinos to be better health care consumers, reduce ethnic disparities in healthcare access, achieve broad access to quality health and dental services, to on-site screenings and testings, and other key and crucial health issues. As I am very excited today, because I have seen things that I try to partner with, and definitely the education is the basic, and one of the objectives is that the person that attends the festival is not just having the blood pressure and testing something. Is that, okay, you have this problem, you have high blood pressure, you have a list of federally qualified health centers where they can attend, because we understand that if they don't take care of their health, it's going to affect the whole community one way or the other. So that's the main purpose of the festival. So they learn something and they have a place where they can. So many of our partnerships, and the health department does a great job about that also, is informing them. They lead with information. And now I am bringing the federally qualified health centers to do the appointments on site. So they begin to trust a little farther, and it's a win-win for both sides. Next one, please. The objectives keep going, and it's provide emergency health related information in a chosen language to help the better informed, offer safe recreational and educational activities for children and youth, provide Hispanic Latino students with access to college education through the Anne Arundel Community College and Hispanic Heritage Church. I want to emphasize a lot about the Anne Arundel Community College. We began having this scholarship for one person. There were some years that we are able to do two. But the most exciting thing, we got so touched this last year that we asked the Anne Arundel Community College to provide us the list of the people that we were able to provide this scholarship. And we were almost tears, because most of them graduated. So that was a huge achievement for the festival. So we are very excited about that. It's working and helping, And the other point is provide consular services on site, passport, consular identification, etc., to Latin American mobile consulates, which I already mentioned to you. Next one, please. This year, once again, this coming Saturday, September 30th, at the Heritage Community Church. Next one, please. And on top of that, we're going to have the Consular Week mobile consulates that is going to begin this coming Tuesday. As a result of the pandemic, some Latin American consulates have requested the use of the host venue to 5 days to offer consular services to their nationals. They are, as I mentioned at the beginning, they are back up, so they are asking us to do more days, and Mexican consulate is coming as September 26th, and it's going to stay all the way to the 30th. Next one, please. I have mentioned also the scholarship, and we began this in 2016, and this opportunity for a full-time and Arundel County student of Hispanic Latino descent with a 3.0 GPA enrolled in a healthcare field of studies and residing in Anne Arundel County. The check is delivered to a college representative at the annual ceremony.
May I say that
Yes.
this scholarship is a blessing. It's a blessing to be able to give it to one of our Latino Hispanic students. You see all the requirements that we have put on. It must be a student that is in the health field. And it will, he or she is immersed in what he or she wants to do in that field. And we have been blessed to, as you heard, that every single one of them has managed to graduate. And it's beautiful to see. As the first one that went to college from my family, when my father used to make $3,050 a year, that is amazing to me. Those are the things that make us continue to have this festival, continue to request help from every single entity in the government, for profit or non-profit, because it's necessary. I lived through that. I used to live in a garage, by the way. So I've seen the other side of this coin, and to be able to help one is more than enough for me. But to be able to see 2,000 plus people this past year is an amazing thing to us. It's marvelous. Sorry.
I do want to interject here and just say that we are at time, we're at 4:00. So for those of you who are able to continue remaining with us, we'd love to hear more about the Hispanic Health Festival. And so if you can be gracious and stay with us for just the next 10 minutes, we can conclude our presentation and end the forum. Thank you.
Thank you. So, attendance and participation, you can see we have several, more than 2,000 last year. We have 38 nonprofit organizations, 19 for-profit organizations. We were able to provide 13 healthcare services. We also delivered 10,000 pounds of produce from Maryland Food Bank. We have 3 mobile consulates, Salvador, Peru, and Mexico. And 1 consular information table from Guatemala. We had a kids corner. We always rely on volunteering. And we had 150 trained volunteers, 16 official and sponsors, and the Anne Arundel County Hispanic Heritage Scholarship. And that's the inauguration from last year. And these are the healthcare providers that we have. The Anne Arundel County Department of Health, Center of Health, Chase Brexon, Emerson Community Clinic, National Kidney Foundation, Solar Healthcare, Dr. Jose Arroyo, University of Maryland School of Dentistry, Annapolis Fire Department, Anne Arundel County Department of Health, tobacco and cancer prevention presentations. Also, we provide presentations through the festival so people get informed while they are waiting for it to be seen. And we also were able to provide the birth certificates and mission. That was a good attraction, and people are asking already for this year. And hearing tests we had last year, HIV testing we always have that one, and they are very, very nice with us, coming every year. We were able to provide emotional health risk assessment, and this year we're going to have the same pediatricians consultations, high blood pressure, blood pressure, glucose, or scheduling appointments, as I have mentioned. The kidney health risk assessment and making appointments, that's very high because a Hispanic population is very prone to diabetes. So that's a very good testing that people can get on the festival's day. Dental screenings, appointments, also they're going to be able to do CPR demonstrations, and we always offer flu shots. Last year we were able to offer the COVID vaccines. So that's basically what we offer, and thank you very much for your attention.
Excellent question. Yes. What time is the festival? From what time to what time?
It's going to be from, we have the inauguration from 8:30 to 9:30. And the festival itself for the people to be seen is from 10 until 3 in the afternoon. For the consulates, they have to make the appointments through the websites.
Last year, the Maryland Kidney Foundation, which is an amazing organization, stayed with us until 4. They wanted to see everyone that came through.
Yeah, that's. Mhm. So thank you, and looking for anybody that wants to come is welcome. We want you seeing how we we convert the church in a hospital for a day. It is very nice, so you're welcome if you want to come and visit.
It's only 85,000 square feet of space. It takes me 2 days to transform it and to change it.
Thank you so much, Elizabeth, and the rest of the community members for being with us today. We do just want to share a brief announcement, and so
Roll to the next slide.
Actually, Dr. again might want to speak to this also. We are, just wanted to pass along to everyone, we are in the process of receiving proposals right now for a violence interruption program in Annapolis, located in the Eastport community. This is going to be a new program for the county to help with, it's part of our gun violence intervention program. And we do have this open for community-based organizations, preferably those with strong ties to that Eastport area. They've got to have the capacity to do the, the fiscal, the staffing, the administrative oversight, but we want this to be a community-based partner, to be the boots on the ground in that community and that trusted voice for those residents. So key dates to keep in mind. We actually have a pre-bidders conference, a second one tonight, from 5:30 to 6:30 p.m. There is a QR code on the screen too, if anybody wants to zoom in on that to get to registering for that pre-bidders conference. The applications are due October 6th. And we're really excited about this opportunity to bring a strong evidence-based program into Annapolis to help to address gun violence in the Eastport community. Any questions, Dr. Gedden? Did I miss anything? You want to add anything? All right.
yes, for tonight, do we have to register or can we just show up?
You would need to register to attend, but it's just your basic, Zoom registration link. So if you do the QR code, it should take you to our landing page with all the information, including the description, the actual request for proposal description. And there's information on that page about how to register for the pre-bidders conference.
Okay.
And you'll get to see me again.
There was a shooting last night again in this Eastport.
Oh,
Yeah.
So, yep, we know this can't come soon enough. And we're really grateful to have the opportunity to implement and try this program out in the community. And really looking forward to our community partner to be the lead for that. Any other questions? Thank you so much.
all right. Thank you all for joining today's forum. We look forward to seeing you next month. And feel free to reach out to us, healthequity@aacounty.org. We will be sharing this presentation. So if you want to refer to any of the content, you'll be able to do so. Thank you all for joining.
Thank you.
She's not here. Yeah, she's out on holidays. Nice. For that, or I think she might retire. That's fair.
Okay, I was like, do I need to eat?
So. Just how involved you are in
Yeah. Such a good. I value it so much.